Hi, this is Dr. Sarosi, and today I'm going to discuss one of the most important decisions when choosing breast augmentation, what type of implant to pick. And really the two choices are saline and silicone. Both are good implants, and they both have the advantages and disadvantages. Saline implant is a perfectly safe implant that is made of a silicone shell, but then is filled with a saltwater solution. So one of the advantages of saline is that it can be folded up and put through a very small incision. So any of the incisions used for breast augmentation, you can fold up the implant, kind of like a taco, and then place it, and then it's filled up in the body after the implant is placed. It has a one-way valve that we pull out the filled tube, and that valve shuts. So the final result is a saline implant that looks like this. This is a 400cc implant. You can see here the valve that's been shut, and this is the saline implant. The disadvantage of saline is the feel. They tend to ripple more, they have a little more unnatural feel than silicone, and actually weigh a little bit more than the silicone gel implants. Another advantage of the saline is that they just cost a lot less than silicone. The silicone gel implants, which are back on the market now for over the last 5 years, is a silicone shell but made of a gel. And there's been marked improvement in the silicone implants. The old silicone implants had a very liquidy feel to them. The new implants have what's called a cohesive gel, more like a gummy bear feel. And actually, the gel implant is a lot softer than the saline implant. One of the disadvantages, however, is with the gel, they're pre-filled. So you have to get them into the incision, but we use something called a Keller funnel these days, and actually makes it a lot easier to place the implant, and the incision can be much smaller. So again, the major difference with the gel is the feel. They just don't ripple like a saline implant. And one of the other differences I'm going to demonstrate now is what happens to a gel implant versus what happens to a saline implant when an implant ruptures, from trauma or just from the implant failing. So right now we're going to go show you first what happens with a saline implant if a saline implant gets a hole in it. So say you have a hole in the saline implant, which I'm going to do right now by making a small cut. What typically happens is from time and pressure the implant empties because it's a liquid. So with time, eventually that implant is going to empty. And it's a fairly obvious thing. The implant is deflated and has to be replaced. But it's perfectly safe because it's just fluid that's leaking out. That's just the saline that gets absorbed. So one thing you'll notice with the saline implant, there'll be even more rippling because the implant now has a hole in it and it's not filled to its volume, and it'll generally ripple. So it's a very easy way to demonstrate what happens with a saline implant. Now with a gel implant, it's a lot different. So if you have a laceration or cut in your gel, you notice here the gel doesn't come out like the saline. Okay, so it's cohesive, it sticks together. I mean, I'm pushing pretty hard on this, and you can barely see a bubble of the gel coming out. So it may be a little more difficult to identify a gel rupture or a leak, but the body forms scar tissue around that implant and walls off that leak, and in my opinion, is perfectly safe. So the bottom line is, what is the best implant for you? And it depends on your body type, it depends on your financial situation. In my opinion, the gel is a much better implant. It doesn't have the rippling. You can see the major difference when it ruptures, what the advantage of the silicone over the saline is. And really the only disadvantage of the silicone is they do cost anywhere from $1,000 to $1,500 more. The other benefit that hasn't really been shown yet, but if you can see, just look at the implants, you can see that the silicone are better made implants. So I think the longevity of the silicone implant is significantly more than the saline implant. On the average, I replace about 10 to 20 saline implants per year for deflations, where with the silicone, I see a ruptured silicone about every 3 to 4 years. So just from my experience, I think the salines are more problematic with rupture than the silicones. Thank you.